All right. Given that we have a quorum, let's go ahead and get started. Madam Clerk, would you please call the roll?
Alderwoman Howard, Alderwoman Ingracia, Alderwoman Evans,
Here.
Alderman Page, Alderman Stevens,
Here.
Alderwoman Schweitzer,
Here.
Chairwoman Green.
Present.
For present, you have quorum.
Thank you. Today we have a couple of guests with us from the St. Louis Fed. As I think many of us have been hearing from our constituents about concerns around childcare and childcare capacity. We know a lot of folks are having difficulty returning to the workforce because of lack of access to childcare and early childhood education. I happened to come across a report that was published in the fall by the St. Louis Federal Reserve that talked about capacity issues in St. Louis City in particular. And so I reached out to the St. Louis Fed and asked if they would come and present today on some of those findings and give us some updates on that data so that we may take that and hopefully be able to use that and make some informed decisions going forward about how in city government might be able to support building some greater capacity for childcare in our city. I will, with that, turn it over to Sam Evans and just let me know when you'd like me to bring up the PowerPoint and I can go ahead and share screen and do that.
Great. So you can go ahead and bring that up, Megan, if you don't mind.
Okay.
Well, while she's bringing that up, I just want to say good afternoon to the aldermen and alderwomen and all the committee members. Thank you so much for your service and putting childcare on the agenda and providing space and opportunity for us to be able to come together and to discuss early childcare and education, looking at both its challenges as well as share some opportunities, hopefully. I want to say a special thank you too to Alderwoman Megan Green for the invitation to be able to present before you today. And also thank you to my St. Louis Fed colleagues who are joining me on this call. And so for the more than 9,000 families of young children under 6, the continuation of childcare is just really critical to the longer term recovery as working families return to the workplace and those considered dislocated working parents as they're seeking new employment as well. And so when we begin to think and develop recovery plans, we know that early care must be part of the discussion, as Alderwoman Megan Green has already said about you all listening to your constituents and seeing as this is one of a key issue. And so I'm truly excited to be able to share with you some of the insights that we received last fall from providers in the region that work with low to moderate income families and what they were seeing around the impact of COVID-19 was and still is having on the sector. And these providers, while they were super resilient, I mean, it was just incredible to kind of hear their stories and what they were going through and how they were still able to overcome some of those challenges. They're really helping to help guide us as we're thinking about future research on this topic. So I'd say that what I'm presenting to you today is definitely unfinished work. It's just for us to be able to, for us to kind of grab that anecdotal information to help us lead to what the research needs to look like. And so before I get into all that context and data and insights, I must share our disclaimer. So Megan, if you don't mind going to that next slide. So if you've ever heard anybody from the Federal Reserve before, you have seen this, that I speak for myself and just for myself. So the comments and the thoughts that I'm going to share with you today do not necessarily reflect the views of the Federal Reserve Bank of St. Louis or the Federal Reserve System, okay? You can go to the next slide. And for those that may not be as familiar already with the Federal Reserve, we are the central bank of the United States. We have responsibilities for monetary policy. And you can kind of think about that as maintaining full employment or maximum employment in the United States, as well as maintaining stable prices. And our community development function and research functions, we've been able to come together, particularly around this issue, which really affects the low to moderate income communities and underserved households within our district. And so we're not only conducting this work, I'd say in the St. Louis and the 7 states that our district covers, but we're actually partnering with other reserve banks so that we can be able to provide some clarity about the cost of providing high quality ECE and the challenges that these communities face, particularly focusing on racial and gender equity issues among providers and parents as they face and paying for it, right? So I've never heard any parents say that childcare costs are too low. And so we're really wanting to probe it and to get at to what that pay is and what that quality is, and especially around the economic equity issues that underlie that. And so we're going to be looking to release a report the first quarter of 2022. So please stay tuned for that. Okay, to the next slide. So just want to say a quick run of show of how I intend to share information today with you. I want to share with you a little bit about the data that's informing how we're looking at early care and workforce development in particular, as it's having an impact on that. And while these indicators provide important data on potential trends, they're just one aspect of what's going on with the economy and childcare. And then after we get into some of the data, I kind of want to delve into the impact of COVID-19 on the childcare, both at what we're seeing at the national level, so what we're sharing with all the reserve banks, but then also getting into from that article that Megan came across and sharing some particular quotes and information from what we were hearing from providers. Okay, next slide. So understandably, we know that choosing a childcare program is a complex decision for families, and not all families choose childcare. They may often rely on families, friends, and neighbors. And so there's many factors, including cost, transportation, location, and quality that influences parents' decisions when choosing childcare arrangements. But as we come to understand the childcare system as a whole, and not just a set of individual choices. And so this is something that I'm keeping very much of top of mind, is that looking at it as a system, not just as individual choices. And while we're able to understand the robust evidence highlighting childcare and education as essential pieces of our region's economic puzzle. And so for working families that rely on childcare to aid in their children's overall care while they're working, they depend on it as participate in training opportunities and being able to advance in their careers, right? And on the other side of that, employers, it affects their ability to be able to recruit, retain skilled workers. And for children, it's a system that can really play a significant role in their cognitive advancement, as well as their social, emotional, and economic well-being. You've seen this probably, and we're definitely looking at the studies, and there's a series, and lots of studies have shown this, a link between early care showing an increased rate of high school graduation, college attendance, and greater workforce participation for those that participate in childcare opportunities and high quality childcare opportunities. Okay, you can go to the next slide. And so one of the main ingredients to childcare is staff. And certain thresholds of age-dependent child-to-staff ratios are really important for safety as well as for supporting child development. And so in this graph, we notice that while hourly wages have somewhat increased, there are large discrepancies between the weekly earnings of childcare workers, looking there at the bottom line there, and those that work with preschool and kindergartners, the red line, and both are below the median weekly earnings for all full-time workers. So often childcare workers are experiencing pay disparity despite having similar education requirements, and job responsibilities as K through 12 teachers, regardless of where that work takes place. And so with wages already low, childcare centers often have few opportunities for finding efficiencies or cutting costs without compromising safety or quality. As well as home-based family childcare providers, they also often earn modest income as well, and especially once it is spread across the long days and weeks providing care. Specifically for those that are able to provide the care for workers that may not work traditional hours, so those that are working outside the 9 to 5, just really thinking about the cost that is associated for them, especially for those home-based providers that are doing that sort of care, that cost burden is really being felt. And so the pandemic really created a number of financial challenges for our childcare providers, on top of the financial challenges that they were already facing prior to the pandemic. And not only did demand for childcare groups drop sharply last spring, so demand definitely did drop, providers needed to modify practices in order to address COVID safety as well as health-related concerns. Okay, you can go to the next slide there. So looking at unemployment rate for mothers and fathers of young children, we see that it remains elevated. In a past blog from 2 of my colleagues at the St. Louis Fed, some of the most significant impacts of the pandemic has been job loss or income loss. And what we see is that women have faced higher unemployment rates than men as the pandemic affected sectors with high shares of female workers, particularly and those service professions. And so furthermore, we see that care responsibilities go on to the next slide there. For young children, disproportionately fell on mothers relative to fathers. And this one here, you can see that is elevated rates among mothers and fathers with children in the home compared to those with children under the age of 5, where it was similar. Okay, next to the next slide. And so now looking at labor force participation rates, we see that it has not yet reached pre-pandemic levels. And looking at this, we see, so participation rates, looking at people already working or seeking employment, we know that the participation rate has not reached those pre-pandemic levels yet. So just this is kind of what that shows. And then looking at the next graph, if you can go into the next one, unsurprising but telling to see that the data is that when we compare labor force participation rates for fathers and mothers residing with kids, and for fathers and mothers with kids under 5, while fathers' labor force participation rate is fairly similar for all fathers, and for fathers' kids under 5, there is a big difference between all mothers and mothers with kids under 5. With the latter having lower labor force participation rates. And also the drop between mothers' average labor force participation rates in the first quarter of 2021 versus the first quarter of 2020 is about double that of fathers. So go on to the next slide. Thank you. And so for even looking at for single mothers, and looking at the unemployment rates, it's quite significant as well. And you see that it's higher than for single fathers. And you'll notice in the next slide, going to the next slide there, and looking at fathers, unemployment rates have significantly dropped. It has been gradual for single mothers throughout the US. And so fathers, like, their unemployment rate has been able to drop significantly rather than at single mothers. Okay, going to the next slide. I thought this data point was fairly interesting, looking at the metro versus non-metro split for Missouri, that despite a lot of fluctuation of the data, it seems that despite metro status doesn't seem to matter nearly as much as sex. And so where mothers in Missouri overall experience higher unemployment rates than fathers. And we know just in looking at the overall data and kind of contextualizing it a little bit is that Large expenses for families typically in the early years of their careers, bringing home less income than they will in their later years, while facing costs associated with family formation. So furthermore, too, is that low income families that qualify for government-funded childcare subsidies, the reimbursement rates typically fall well short of the actual cost of providing that particular care. Next slide. And looking at the impact of COVID-19 on childcare, the pandemic laid bare the precarious economic and social conditions of children and families. Even more so, I would say, for Black and Brown tribal communities. As noted in our Federal Reserve System work group briefing that we released last summer, is that COVID-19 upended typical care systems as parents lost work or started working at home, and many child care providers closed. The lack of childcare was particularly problematic for healthcare workers and first responders with young children who needed childcare in order to go to their jobs. Next slide. And this is not something that we were just seeing and noting with the Federal Reserve System, but also with NAEYC that conducted a survey, and they do these surveys yearly and annually. I believe the next one is coming out just next month. And they're working to capture provider sentiment, and found that providers were facing challenges of remaining operable. With not only that, but experiencing high turnover rates, increased costs and challenges with capital, technical assistance, being able to find where the resources were, grants and opportunities, and being able to apply for loans such as that Paycheck Protection Program loan that we were seeing. And I think that it reminds us that a lot of the providers are small businesses. And so being able to seek out those opportunities was definitely a challenge. Okay, go to the next slide. And the findings there are pretty. Next slide, please.
Megan or Alderwoman Green might be frozen. She's frozen. Maybe.
Oh no.
It's a good slide though. We lost her.
Oh no.
Her internet's been acting up a little bit, so just give her a second. She'll hop back.
Okay. Well, I think that's a good way to pause. If there's any questions on what I've said so far, feel free to take this time to kind of ask. I think we can possibly do that if that's okay.
If I might preemptively ask Ms. Evans, did this study account for home daycares? Because coming from largely from the early childhood care industry myself, the two main sectors of childcare are sort of storefront daycares, independently located daycares, and then also home daycares. Do you know? Oh, Alderwoman Gracie, I'm sorry, Ms. Evans. The vice chair is Alderwoman Evans from the 4th.
I'm sorry, I missed that question, Bill.
Sorry,
Alderman Stevens, I'm sorry.
Oh, that's okay. I'm just Bill. Alderwoman Evans, Alderwoman Gracia has absolutely pointed out that I have been remiss in posing a question to Ms. Evans. So preemptively, in the absence of the chair of the committee, Ms. Alderwoman Green, you are the de facto sort of leader of the committee. So with that note, thank you, Alderwoman Gracia. Alderwoman Evans, I defer to you. I apologize.
Okay, and I'm sorry, I stepped away for a minute. I've been on Zoom meetings all morning, so I had to take care of my needs. And when I came back, I missed what you were saying. I did hear what Miss Evans, Samantha Evans, was saying about preschoolers in education. But what was your question to me, Mr. Stevens?
Well,
Alderman Stevens.
I suppose I would ask Alderwoman Evans if I can pose a question to Miss Samantha Evans regarding the study and the comprehension, sort of how comprehensive it was in including both standalone daycares and home daycares in capturing the data.
Yes, you may.
Excellent. Miss Evans, I apologize for that little procedural sort of back and forth.
That's okay.
My apologies, my internet dropped there.
Well, we kind of got out of turn, so I actually opened it up for questions, and I think I kind of broke the Robert's Rules of Order there a little bit. But I don't know if you want to continue with Alderman Stevens' question, or if I should continue on with the presentation.
Why don't you go ahead and continue with the presentation, and then we'll go on to questions afterwards.
Okay, I can do that. Are you ready to fire it back up? I think
Yes.
I'm on, let's see.
So I think I have it back on the right slide.
Okay, slide 16, I believe is where I'm at.
Okay.
Chairwoman Green, we're seeing the Zoom page.
Zoom page, interesting. Okay. Let's try that again.
There we go.
Okay.
Aha, there we are. Thank you so much. So where was I? So the findings that I was highlighting in the previous presentation or previous slide really looked at some national survey data. And I just wanted to include that to highlight that it was pretty consistent with what we were hearing from the childcare providers we interviewed, and that these challenges were not even unique to COVID-19. Even before the COVID pandemic, many working families struggle with the high cost of childcare, and providers stated, and even looking at the IFF report from 2019, the region experienced some of the lowest reimbursement rates in the country. As one provider shared with us, in particular example is that her infant costs can total up to sometimes $19,000 a year. And however, that reimbursement for such care only covers half of that. And while during the pandemic, the state authorized and continued to pay subsidy providers, subsidy payments, I guess I should say, in which providers, they mentioned and said that they were very grateful to be able to have that. These funds alone were insufficient for providers to remain solvent given the loss of private pay funding by families, which a lot of them actually rely upon even if they're able to have subsidy slots. And then looking at data from the Childcare Aware Missouri in 2020, the region was also experiencing a service gap of 47%. However, I will note that increasing capacity is not just that simple. As noted by my colleague Nishesh Shalisi in an article he recently co-wrote with members of the SCIP designed here in St. Louis, and noting that these goals, while they could minimize negative unintended consequences by increasing the capacity, it actually really requires a much deeper understanding because of the different nuances that are here in our region, and the interconnected nature of the ECE system overall. And so I wanted to highlight that and note that for you all as you're thinking about increasing capacity or not increasing capacity here in the region, as this is a resource for you as well, not just what I'm presenting here today, but also the continued work that continues with our group. And they really note how to grow access while maintaining quality and ensuring those equitable outcomes in which we want to ensure. Okay, next slide. So what did we hear overall from providers? Well, both centers and home-based providers, and I think this gets to your question that you were going to be asking Alderman Stevens. We saw that they both experienced significant financial and operational issues. However, there was some uniqueness in that, and that while they were unique, were centers and those that operated as nonprofits. They had to increase their strategic growth. They had to decrease, actually, I should say, their strategic growth goals. And they no longer could braid those various funding streams together. So thinking about those nonprofit centers that are often able to rely on board assistance and fundraising events, they no longer were able to do that. And those home-based providers actually struggled to connect even more so with the financial institutions and other resources to be able to get the supplies needed to remain operable. And so we were seeing, hearing from the home-based providers in which that may not have had that distinct relationship with their financial institutions, really struggling in that first round of when PPP was often offered, and being able to get to that quickly. Some other things were that cost increased as well, and there was some anxiety in the early days. And so I want to share with you a few of those quotes that we received from some providers. So if you could go to the next slide. We have a quote here from Tina Mosley, in which she says, "I wake up every day questioning, am I sacrificing my life for my business or my business for my life?" And she's here in St. Louis, and I just commend her for being able to speak openly and candidly about what she was experiencing in those first few months of the COVID-19 pandemic and what that was like. And despite closing early on, she did close, but then she reopened. However, had less. She opened at half the capacity. And so Ms. Mosley, what she did during those times when she was closed, she actually teamed up with other providers and she began to provide resources and for those that did remain open for those essential workers, and often driving for miles to find and locate PPE, as well as Pampers and other resources for the families that she served that may have lost their jobs or didn't have opportunities to be able to get out. And so she also was reviewing and remaining up to date with the CDC guidelines and helping to recommend and provide recommendations on what it was truly like on the ground, and creating manuals for providers and helping them to understand what was going on. And so through this informal network that she created, she was able to turn that in with another provider into a nonprofit, and being able to really utilize and connect that and build that network up. Next slide, please. Next, we heard from Cortez Collins, and Ms. Collins shared that if I had to shut down more than once due to COVID-19, I don't think that I will be able to survive. And I just want to highlight and note that this was early on in the pandemic when guidance was in flux and providers were unsure as to what that would look like. We were still trying to understand COVID-19 ourselves. And so here she just really shares about how the shutdown policies and subsidy reimbursement for absences, where, early on I only covered maybe 5 absences, where the CDC guidelines said you had to, close down for 12 days or so. And so she was really talking about the close due to exposure really affecting her business. And while, like I mentioned, I'm unsure about how these policies have changed thus far, I just wanted to kind of highlight and note this as something that we were hearing. Go ahead to the next slide. So here in this next quote, we heard from Alicia Lanier with Urban Sprouts in University City, where she said that families were disjointed from their everyday normal. And we saw parents losing jobs and children not being able to be with their caregivers. And we saw a little bit of trauma. And so I wanted to bring this quote up because I think it really just shines a mirror on something that we don't often talk about when we're thinking about providing childcare supports and how it connects to the workforce, but it also connects to these other services and things that we rely on our providers to be able to provide. And so this just highlights the trauma and the anxiety providers were seeing and facing with the children and the families that they served. And we heard how providers were actually beginning, as they were beginning to open up and seeing this, they were dealing with in addition to dealing with the list of other challenges that they were dealing with. Providers and operators were actually scraping together resources to connect these families with a broader range of health and social services. And even Alicia Lanier was talking about connecting, being able to provide those scholarships for parents and families that were seeking employment, may have lost jobs, and as they were seeking training, being able to provide those scholarships and connecting them to those resources, and how important that was. So with these last two slides, I just want to go on to the next slide to kind of leave you with some of these takeaways with you as we continue to explore through this conversation, and that how childcare is both a workforce support and contributes to the foundation of children's education. And really we see being able to center providers' voices as essential to this conversation. Childcare, it's one of the ways in which we're thinking about two-generation impact, both on the development of children attending childcare, as well as the ability of parents to enter the workforce and be productive at their jobs. Wages for childcare staff are already some of the lowest in the economy, even though the high societal value that it provides. And profit margins at childcare providers, they're already thin. As well as a number of factors related to COVID-19 have had significant short and long-term implications. And while we cannot say for certain what happens in the future of childcare remains still, even to this day, unclear. But providing access to capital, technical assistance, and quality supports can definitely go a long way. And I'd note too that a current drop back in the fall that providers were experiencing for ECE is probably possibly temporary, and many related to high levels of unemployment, in which I was showing through the data earlier. And at the level as employment increases, we're hoping to see where parents go back to work and we can expect demand to increase. However, we don't know parents' preferences. And so that's something that we're teasing out too in our national data that we hope to highlight here in the first quarter of 2022. Other problems that if some ECE centers shut down due to financial distress, there will be a lack of available childcare, which will make it difficult for parents to return to work. One last impact I want to note is that we heard from providers that extra cleaning, PPE, and isolation between classes not only reduces the possibility of contracting COVID, but also other illnesses. And thus, some providers mentioned that they're going to keep these measures probably stay in place, which means that those increases in budgets due to PPE is probably going to remain. So those costs are going to consistently be just up and not take a drop once recovery begins. And not all providers and operators, I want to make sure to note this, they're not the same, and that the solutions will reflect care types, geographies, and those areas, as well as their racial and ethnic composition. And so the good news, I'd say, is that the St. Louis region has made great strides to keep the childcare system solvent through federal, state, and local grant funding during the pandemic. And as the region pivots from response to recovery, perhaps these support strategies focus on disparities and access can also ensure families who are most affected by the pandemic. This can include expanding access among Black, Indigenous, and people of color communities and low-income families so that they are able to have access to child development benefits of high-quality childcare. And for our region is that providers that I was able to see and note within these conversations with the providers is that they're often easier to gather a cross-sector group of stakeholders to being able to develop local solutions. And so I think that's something that we can walk away from through this conversation. So lastly, I'd just say definitely please connect with us. This isn't the end of where we're seeing our work in this particular sector. So definitely connect with us. And here on the last slide, you'll be able to see our website and other publications in which you can be able to gather information from us and being able to connect with us on any of your needs in this particular area. And thank you. With that, I'll close and open it up for questions. Yes?
Yes, thank you very much. With that, I'll take questions from the committee. I'll start with Alderwoman Ingracia.
No questions. I apologize. I was late to the presentation, but I have read what's on the website. Appreciate your work and appreciate you coming before us today.
Then in terms of...
Thank you so much. Appreciate that.
Alderwoman Evans.
Yes, being that, I guess you could say, some of the restrictions have been listed that has been lifted due to COVID. Do you see, I guess, the small businesses rebounding?
Yes, Alderwoman Evans. As I mentioned earlier, as that really have to look at the ECE system and what has happened through COVID-19 and its impact, both a short-term and long-term. So we definitely noted that as things open back up, that demand will likely pick up. However, those costs have increased and have affected their bottom line overall. And so we do highlight and note that demand will possibly pick up, and we'll have to go back to our providers and being able to kind of shape and note that. But it does seem that those costs as demand has picked up, makes those cost burdens even more so, right? Because there's increased staffing that has to be done as the class size and classroom sizes have decreased, actually. Looking at being able to provide those supplies on an ongoing basis around PPE and other supplies that are needed, those costs are actually going into their budget as well. So that's something that, yes, we did note.
Okay. Thank you.
Alderwoman Schweitzer.
Hi, thank you so much. My question is regarding best practices in other cities. If there's a city that you feel like is doing supports for early childhood well, anything that we should learn from them or research that we should be doing as elected leaders in the city of St. Louis?
That's a good question, Alderwoman Schweitzer. I would say when looking into this issue, because this was a new focus area for our bank, and so we relied heavily on the community organizations that were already in this space, including such noted organizations as We Power, that actually has the playbook on ECE that they issued out, I believe, in 2019. And we note that in one of our reference points. And I believe that they looked at the city of Tulsa and some other reference cities, similar cities, to help guide and provide some actionable recommendations in their report. So yeah, I definitely defer to them and what they've seen, as well as IFF, a CDFI that works here in our community in St. Louis region, but as well as in Kansas City. So they're currently working on a report with the Kansas City region and looking and noting that. And before they came to St. Louis, actually did a report out of Detroit and looking at some best practices there that they highlighted from them. And so I think that those are just thinking off the top of my head as two resources that come to mind that I've actually done and looked at other cities similar to St. Louis and looking at some best practices that may be able to help guide you all in looking at that.
Thank you. And those numbers you gave, those were nationwide statistics, not St. Louis specific.
Right. Yeah. They were nationwide in the beginning. And then I think the last one was looking at Missouri. However, I will note that we do have some of our colleagues who are going to be offering and can be able to offer some of that data if that's what you're looking for. So
you know, just think
that's
about
kind of something that you're looking for. We can think strategically about what is needed.
Right. I just think about the amount of money that St. Louis got in their recovery funds and how that's related to a lot of the issues that St. Louis has, and sort of wondering if, kind of similar to that these childcare issues are more pronounced in St. Louis than other places in the country, and if we have a bigger mountain to climb or if we're pretty comparable. That's just not something I'm really familiar with.
No, I think that's a great question and something that we were wanting to probe as well and wanting to know further about as well. And even thinking about the ARPA, American Recovery funds that are being that have been issued out. We're actually with the working group that I had mentioned, the national working group of all the reserve banks. We're actually issuing a report on best practices and considerations for what those funds have been or looking at to be utilized for. So be on the lookout for that. We're actually going to release that briefing next month. So as soon as that comes out, I'll definitely share that with Alderwoman Green to be able to get out to all of you all.
Thank you. And thank you for your presentation. No further questions at this time.
Thank you. Alderman Stevens?
Yes, hello again, Ms. Evans. Hello again. I do have several questions that I would like to ask, especially coming from an early childhood education background through the public library. Let me turn off my little fan there. First and foremost, I'm not surprised, yet I remain startled to see the data and statistics on women, specifically mothers, and their unemployment rates. What is the greatest, or is this study able to speak to the greatest barrier for women? Is it that when under economic pressure, women are more likely, and let me back up and say early childhood care is economic pressure. You spoke to that earlier and how expensive early childhood care costs are. And I mean, for anyone unfamiliar, early childhood care costs are very astronomical. Is that the greatest barrier, that when under economic pressure, women are more likely to stay home or perhaps voluntarily stay home as caregivers? Or is the study able to speak as to the greatest barriers for women in the employment sector or in?
Yeah, thank you for your question, Alderman Stevens, and as well as your previous service in this sector. I would definitely highlight that not just even in the article that we're presenting around providers and connecting that to the workforce development, but that there's been several others, even at our bank, looking at the SHE session, looking at women leaving the labor market, as well as even just as Monday, we came out with an article, and I can share it here in the chat here in a little bit, looking at labor force participation rates among women. And so we definitely see that there is a connection there, that there is a correlation there between childcare and women participating in the labor force. What that is and how long that's going to be, I haven't seen anything kind of really leading to that. And so I definitely would say that there definitely is some strong correlation there. As well as, there's a survey we noted in a previous article that I had mentioned about some of my colleagues looking at particular women in the workforce, is that the McKinsey study highlighting women and how they surveyed women and looking at women, what their preferences were whether they were moving back into the labor market, what was the challenges of that. And so I can share that article. So 2 articles to being able to showcase and highlight that. Be happy to do that here in the chat once I can find them.
Oh,
Or
please.
share them with Alderwoman Green to be able to share later on.
Absolutely. I would appreciate that because, I mean, in any sector, but especially with childcare, it's such a web, you know, in that if you tweak just one little bit of it, or if you put additional pressure on just one piece of the web, then the entire thing reverberates. And I'm keen to see what is the greatest barrier presented there for our families, you know. And I suspect it's economic. That is anecdotal, and I cannot enter that into any official record, but I would deeply appreciate any additional information or even a general direction which I can head to get that information. Would you be able to offer any input on perhaps anecdotal input, understanding it is your views and not the views of the federal bank, on the projected impact of the new child tax credit, or rather the recently raised child tax credit that the Biden administration has implemented? I believe from 3,000 to, what is it, 3,600 per child. Do we suspect that this is going to ameliorate or sort of further support the childcare industry by relieving that economic stress, or would you rather not speak to that? Understanding it's a very broad question.
I would just say that we haven't, no, I appreciate your question. I would just say that we haven't done any research or findings or data along those lines to be able to highlight the impact of that as of yet.
Okay.
Nor do I know if there are plans to do such.
Okay, and that's absolutely fine. I don't mean to pose any sort of gotcha questions, but working with my background, it was always financial. And, you know, we often joke that you can joke bitterly so that you can tell, sort of forecast a child's success based on the schools they go to. And I believe that extends to daycares and childcare centers. And it, 9 times out of 10, it does come back to economic issues in my experience, where childcare is too expensive or the transportation is too expensive. So I'm hopeful that this increased child tax credit, increase to 3,000 for each child, 6 to 17, and 3,600 for each child under 6 is able to support that. But then the greater problem is, are we able to adequately feed these children? You know, are our parents able to make enough money to properly care for not just their children, but themselves? Because a nuclear family has to be looked at holistically. So I apologize for pontificating there for a bit. Shifting from families to daycares, both home and standalone daycares, with not only the uptick in having to address PPE, personal protection issues, or personal protective measures, such as distancing, additional cleaning, so on and so forth, but also with some providers wanting to maintain those additional measures due to the ongoing benefit of illness reduction and so on and so forth, sort of illness mitigation in childcare facilities. Is there any projected or potential impact, or did we see any impact on having to divert funds from maintaining compliance with the state and having to sort of shift that focus from compliance to personal property? Here we go. Can you tell I'm a legislator? Personal protection measures, because I'm curious to see if, you know, having to divert funds from updating the paint, if there's a paint chip issue present, well, that's a non-compliance violation with the state. If doors don't auto latch, that's a non-compliance violation, so on and so forth. And enough violations will result in fines, fees, additional economic impact, and even closure in some cases, revocation of a license. So can you speak to whether or not we saw any of that, to sort of adjacent issue maintaining compliance out of having to, sorry, Alderwoman Evans, do we see any potential issue with non-compliance as a result of having to focus on personal protective measures, or? Or can this presentation, this brilliant presentation, speak to that?
You know, Alderman Stevens, we didn't hear any of that coming from any of our interviewees as far as, you know, the compliance system and trying to maintain compliance as opposed to keeping up with the PPEs and supplies, and if there was a shift in that. I think that's definitely a great question and something to be probed and probably to ask at the state level as far as what that concern is. What we did hear is that, as I mentioned earlier in my presentation, is that the providers were definitely grateful to being able to have those funding opportunities that came through the federal and the state, to being able to help to maintain their levels of solvency, to being able to get from day to day, and being able to provide that PPE, or if they had to have an increase of staff because of those smaller class sizes that they had to maintain. In addition to, you know, speaking with those providers, they were actually, you know, they would go into their day-to-day job, and then at night they were applying for federal or grants in order to being able to fully supply out what those terms and what those were. But as far as like the compliances, I don't know if they were paused for a second or if they maintained or if there was some discrepancies there. We didn't hear any of that from our providers.
Okay. Final question, I promise. Are there any steps currently being taken or have been taken to mitigate any potential sort of similar issues in the future, such as from if we have another pandemic or if we have another natural disaster or so on? Do we have sort of contingency plans, or are we able to, do we have sufficient data to create? Sorry if anyone can't hear me. I believe I'm having mic issues. I've gotten a few comments for it. Are there any contingency plans to mitigate economic impact, detrimental economic impact on daycares and early childhood care providers for future issues? Or is there sufficient data from what we've just all been through in order to help formulate a plan?
I think that's the next step, right, Alderman Stevens? Right now, we were just kind of highlighting and noting that there was a definitely significant impact that COVID-19 created, especially for our low to moderate income communities. And so I think in this next round, in the second round, as we're looking and as states and cities and communities are looking to pivot into recovery, we're looking at exactly what does that look like? And so as we're thinking about that, we're wanting to highlight and note that, yes, there was an impact. Yes, we do need to concentrate on resiliency. And then even so, I think what has laid bare, not just within the COVID-19 pandemic, but in the racial and economic inequities that came to lay bare too over the summer of last year, is to look at how there can be equity within baked into some of these things that we're seeing come out of this. So as we're thinking about recovery, we're thinking about an equitable recovery. And so we're seeing a lot of our communities, and even here in the region, looking at what that looks like. And there's some great organizations and folks that are coming together and really trying to create an interconnected system within the ECE, both on the providers and parent side, to being able to do that.
Excellent. Well, let me say here now that I'm happy to be a part of that in whichever way I can support it in the creation of that plan. And I want to thank you immensely for this vital study and this vital presentation. I think very often we sort of muse on how expensive early childhood care is or the impact on our families. And what you've given us today is hard data. You've given us personal testimonies from interviewees, and you've given us the information, even additional information in the chat that's going to help form a plan. So I'm deeply appreciative for your work. I think it is very necessary work, even though I might be a bit biased coming from this sector. And I am very happy to support it in the next steps in whichever capacity you need me to support it. Even if that means taking a step back, you can always say, Alderman Stevens, sit down, and I will sit. So thank you for your time. Thank you for your presentation. And with that, Madam Chair, I yield back.
Thank you. It looks like
Thank you so much.
Evans might have a follow-up question. I'll go to her and then over to Alderman Page. Alderman Evans, did you have a question?
No, my hand was up because I couldn't hear Alderman Stevens. I'm sorry, but since I've been called, I would just like to thank Mrs. Evans because she did a fantastic job at giving us information with the effects of COVID on the childcare sector. And I just want to thank you for that.
Wonderful.
You're welcome. Thank you so much for having me again.
You're welcome.
Alderman.
Yes, Ms. Evans, thank you so much, first and foremost, for such an excellent presentation. One of the things that really caught my attention came midway your presentation, and that was the tremendous gap between the actual cost of service for each student and the reimbursement rates and opportunities for private pay. Those gaps sound to me like a formula for insolvency. And I didn't, if you shared it, I didn't grasp it. How many of these interviewees were availing themselves of resources to close these gaps, to remain in business, maybe not numbers, percentages, whatever, and how many of them didn't and had to go belly up? Do you have any feel for that?
I do want to kind of turn to some data or resource organization, Childcare Aware Missouri, which does print that information yearly. And so we can go back from 2020 to 2021 to track how many, between the family centers that have opened, as well as the state, I believe, tracks that information as well. I do not have that information currently, and we can probably connect later on here to see if we can find that information readily available for you. But yes, I do want to just kind of note and highlight, I'm so glad you brought that back up, is there's this discrepancy, and really I was just floored by the great candid conversations that I was able to have with these providers. But then in noting and highlighting their resiliency, we haven't went back to them to see how many have gone belly up or how many have been able to persevere and move through that. However, I will say throughout that conversation, it was great to be able to see how many of those providers were able to connect and come together. That's why I said here in the region, we have a great opportunity because these providers were connecting together and being able to create these informal networks and getting together. And even whenever we lost one of the interviewees, they were saying, oh, I know another person you should interview. So it was great to being able to see that and that connection and how they were able to support one another. But yeah, you're right. The cost of infant care is 17% of the median income. And this is, 10 percentage points higher. And so for a market that relies heavily on those, families being able to provide, funding, this market is definitely one that is kind of titillating on being able to have full support. And so I think that's just something here that we've noted and highlighted, and very encouraged by your committee and being able to bring this light to bear.
Thank you. And thank you, Madam Chair. I yield back.
Thank you. And while she's not on the committee, Alderwoman Rice is here today. So if you do have any questions or want to chime in, I also want to give you the opportunity to do that. Not have her audio connected. Right. I do have a couple of questions to, I also come to this from an early childhood background at provider level at Lee May Child and Family Center for a number of years, and prior to running for office, and actually through my first year in office, worked at Childcare Aware of Missouri. So these are issues that are pretty, near and dear to my. I know that even, prior to COVID, we had some big capacity issues and capacity gaps. And one of the things that I continue to hear from my constituents is particularly issues around infant toddler care, and that basically the moment folks are getting pregnant, they're having to get on waiting lists for places, and those waiting lists are often 18 months long while your child is barely a toddler anymore by the time that they're able to get into an infant toddler program. And so I guess one of my questions is, has the data been broken down and looking at these service gaps and how it relates to gaps in the infant toddler arena versus the pre-K, so we can maybe get a better idea of where we need to be targeting capacity?
Alderwoman Green, that's a great question. This study did not speak to that and the narrative of being able to get those interviewees. But I think that's a great question and something that we should look at and definitely probe. And I wonder too if some of these other organizations that we've been in constant communication with possibly have that information. So that's something we can maybe follow back up with to see.
Thank you. And the other, I think, question I have, and or maybe charge for us going forward is, I know from working in this arena, kind of the difficulties we face at a state level in terms of trying to get the reimbursement rate raised, and which often feels like a non-starter in a lot of ways. And so I think as a committee, we're probably interested in, what local solutions might exist, or places that we should be looking for local solutions for how we can adequately pay staff at our early care and education providers, and how we can help close some of these so that we don't see centers and providers facing these insolvency issues. So I'm just curious if there's places that you can point us, or about looking toward those local solutions when we might not have as sympathetic of a state as we would like to have in partnership on some of these issues.
Yeah, I think that's the grander work of what you're doing and what others are doing in the space. And earlier in my presentation, I kind of talked about some of the research and work, and even in our Bridges publication at the Fed, my colleague Nishesh Shalisi with another organization, Skip Design, kind of, they have research looking at system dynamics and looking at the nuances within the ECE sector, particularly in our region, St. Louis region here. And I think that in looking at that information, and I should be able to provide a link, I promise to be able to get you links to all of these resources that I'm talking with. But I think that's a great starting point, right? It's the being able to look at this, or there's, already research that has happened in our region in which we can look back on and step back into. And there's quite a few individuals that are already in this space that are really being able to probe at and get at particular around this capacity issue, and how to get at key ways, key factors to include not just increase the slots for childcare and subsidy care, and the subsidies around that, but they're actually talking about how we can increase slots for their quality childcare. And so there's definitely organizations and research that's already probing at these very exact questions that I definitely encourage you all to kind of start with and look at, because that's where we're looking as well, and it's being able to provide some clarity as we're teasing out what this looks like overall, and getting at that quality issue as well as equitable outcomes issue.
Yes, because we're also, I'm sure as you're aware, the only state with a quality improvement rating system, and so that yet another challenge that Missouri faced in this arena, and another way that we, perhaps need to look at some local solutions. And so I think, this, I wanted the committee to meet today to talk about some, sort of a first step in looking at some first, what the problem is, and so that we can start to move forward into some solutions-based conversations, especially given, not just the ARPA money, but the fact that childcare is being talked about as part of infrastructure funding in the federal infrastructure package. And if that holds true, and St. Louis ends up receiving infrastructure money that includes childcare funding as well, what is that? What possibilities does that create for our city in being able to address some of these service gaps, and if we're starting to build some of these relationships and have some of these conversations now, can that set us on a path to being able to address some of these issues, not just
Is that my computer or is she frozen?
No, she froze again.
Okay, thank you.
Yeah, I think she's temporarily left us.
All you, Alderwoman Evans.
Well, okay, and I'm new at this. I don't know what else Chair Green had to cover. Oh, she's back. Unmute yourself.
My apologies. My internet just cannot seem to get itself together today. I did notice that Alderwoman Rice is on camera now. Alderwoman Rice, did you have questions?
No, I'm sorry. So this technology today is just giving all of us headaches. I don't have any questions. I just want to thank you so much for a really great presentation, and for holding space for this discussion, Madam Chairwoman, and thanks for letting us all tune in. I think it's important information, and we've got good work to do.
Well, thank you. And thank you to the committee members. Before we adjourn, we do need to approve the minutes from last week's meeting. And so I would like to entertain a motion to approve the minutes from last Tuesday, whatever that date was.
So moved.
The 22nd.
Yes.
Second.
Okay. Madam Clerk, could you please call the roll?
Alderwoman Howard. Alderwoman Ingracia. Alderwoman Evans.
Aye.
Alderman Page.
Aye.
Alderman Stevens.
Aye.
Alderwoman Schweitzer. Chairwoman Green.
Aye.
Alderwoman Howard. Alderwoman Ingracia. Alderwoman Schweitzer. 4 aye votes.
Thank you so much. And again, before we adjourn today, I really want to thank Sam and Violetta for joining us today, for the St. Louis Fed for supporting this work, for, hopefully this is just the beginning of some further conversations, and, let's definitely keep in contact around this issue and see how we can work in partnership in addressing some of these capacity issues here at the local level. With that, I will entertain a motion to adjourn the Education and Youth Matters Committee.
So motioned.
Second.
Somebody want to do previous roll?
Previous roll.
With that, the Education and Youth Matters Committee is adjourned for today. So thank you, everybody, for your time and for your attention to early care and education in our city. I appreciate it.